Ever heard of nipple discharge? It's more common than you might think. Over 80% of people assigned female at birth will experience it at some point. And while it's usually harmless, it's natural to wonder, what does it mean, and could it be a sign of something serious? Let's break it down. Understanding nipple discharge, when it's normal, when to watch. Nipple discharge simply means any liquid coming from the nipple. It might leak out on its own, or you might notice it when the nipple is squeezed. A lot of the time, this discharge is nothing to worry about, especially if you're within your reproductive years. But here's where it gets tricky. Sometimes, nipple discharge can be a symptom of an underlying issue, even something as serious as breast cancer. The anatomy behind discharge. Here's something fascinating. Each breast has around 20 milk ducts. Those ducts can produce fluid for various reasons, not just breastfeeding. Hormonal changes, certain medications, even things like stress or injury can cause these ducts to leak. Discharge can appear in a range of colors and textures, from clear to milky, and even sticky or thick. Each type might give us clues about what's going on inside the breast. What the color of nipple discharge might mean. Color can be one of the first indicators to pay attention to when you notice discharge. Though it's important not to self-diagnose, certain colors are often associated with specific causes. Let's go over some examples. Milky white. This is common and often related to hormonal shifts, like those in pregnancy, breastfeeding, or even medications that boost prolactin, the hormone that stimulates milk production. Green or yellow. These colors might be linked to a harmless condition known as mammary duct ectasia. While it sounds serious, it just means there's a blockage or widening in a milk duct, often resolved without treatment. Bloody or red tinged. This is where you should definitely take notice. While it's not always cancer, bloody discharge can sometimes be linked to more serious conditions, like a small growth called duct papilloma or, in rare cases, ductal carcinoma in situ, DCIS, a type of breast cancer starting in the milk ducts. Colors and textures can hint at causes, but they're just hints. If you notice discharge, it's best to speak with a doctor for a professional opinion. When is nipple discharge a cause for concern? Discharge doesn't usually signal breast cancer, but it's worth getting it checked if you notice certain warning signs. Here are some key things to look out for. 1. Bloody discharge. Blood in the discharge can sometimes be linked to cancer or other abnormal growths in the milk ducts. 2. Only one breast is affected. If only one nipple is discharging fluid, that's more unusual and worth looking into. 3. New or persistent discharge. New symptoms or changes in your breast health deserve attention, especially if the discharge doesn't go away over time. 4. Accompanying symptoms. Pain, lumps, or changes in the appearance of the nipple or breast skin, like crusting or color changes, can also be signals of underlying issues. Men can experience nipple discharge, too, though it's much less common. If it happens, it's usually a sign that something's going on that needs medical attention. Common causes of nipple discharge. While breast cancer is always a concern, it's actually one of the rarer causes of nipple discharge. Here's a breakdown of some common causes. Hormonal changes. Menstrual cycles, pregnancy, breastfeeding, and menopause will bring hormonal shifts that can trigger discharge. Medications. Some medications, like certain antidepressants or tranquilizers, increase prolactin levels and may lead to discharge. Breast infections known as mastitis. Infections cause painful, sometimes red, inflamed breasts with possible discharge. This is often seen in breastfeeding individuals but can happen to anyone. Benign tumors or growths. These might sound alarming, but many growths in the breast, like papillomas, are non-cancerous. Breast injuries. Trauma to the breast can lead to temporary discharge as the tissue heals. In many cases, nipple discharge is a body response that doesn't require treatment. Why squeezing isn't the best idea? A lot of people are tempted to squeeze their nipple when they notice discharge. It's a natural reaction to want to test it. But squeezing can actually irritate the tissue and worsen any underlying issue. If the discharge is mild or occasional, it may resolve on its own without intervention. Let it be, and see if the symptoms lessen. But if it's a constant problem, especially without squeezing, make an appointment with your healthcare provider. What to expect at the doctor's office. Your doctor's approach to nipple discharge will start with some simple questions. When did you first notice the discharge? Is it in one breast or both? Does it only happen when you squeeze the nipple, or does it leak on its own? Have you noticed any lumps, pain, or other symptoms? From there, they may recommend some tests, which could include mammogram X-ray images of the breast to look for any unusual masses. Ultrasound uses sound waves to create an image of breast tissue, particularly helpful in spotting cysts or masses. Ductogram. This specialized test involves injecting a contrast dye to get an image of the milk ducts. It's not always necessary, but it can be useful for tracking down specific sources of discharge. Biopsy. If there's a lump or concerning area, a biopsy can be done to check for cancerous cells. Treatment options. What's next? The treatment for nipple discharge depends entirely on the cause. If it's due to something harmless, like a hormonal change, you might not need any treatment at all. For issues like infections, your doctor may prescribe antibiotics, and for benign tumors like papillomas, surgical removal might be an option if the symptoms are bothersome. When it's due to breast cancer, the course of treatment varies depending on the stage and type. Early diagnosis leads to better outcomes, and treatments range from surgery to targeted therapies. Remember, only 9% to 21% of nipple discharge cases turn out to be malignant, so it's a rare outcome, but not impossible. Summing it up, when to worry, when to wait. Let's recap. Nipple discharge is common, and most of the time, it's harmless. If you see bloody or persistent discharge from one breast, or experience additional symptoms like pain or lumps, get it checked out. Avoid squeezing to see if the discharge goes away on its own. Remember, tests like mammograms, ultrasounds, and even biopsies can give you peace of mind. If you're ever unsure, don't hesitate to reach out to a healthcare professional. Breast health is something we don't want to gamble with, and catching issues early is always beneficial. Final takeaway: your breast health, your peace of mind. Nipple discharge is one of those topics that's rarely talked about but surprisingly common. Having this knowledge means you're better prepared to understand what's normal and what's not. And remember, your healthcare team is there to help you figure it out. So don't ignore it, don't stress about it, take charge, get informed, and ask questions.